Hi, everybody. Welcome back to our lecture on cardiovascular system. We have discussed the heart anatomy in terms of the main chambers of the heart, as well as the main blood vessels that either enter or exit the heart. The next set of structures we're going to talk about are your valves. So there are a total of 4 valves in your heart, and the basic functions associated with these valves is to prevent the backflow of blood to chambers of the heart. In another sense, these valves are placed strategically throughout the heart to make sure the one-directional or unidirectional flow of blood inside the heart. For instance, if the blood is moving from the atrium down to the ventricle, you don't want that blood to go back to the atrium again. Or when your ventricle is pumping blood into the blood vessels and away from the heart, you don't want that blood to come back toward your ventricles again. So these valves, again, these 2 sets of valves, a total of 4 valves, are responsible for making sure that blood is moving in one direction. So what are the names of these valves? Now, the first set of the valves received their name based on their location. These set of valves are located between the right and left atria and their corresponding ventricles, and therefore they receive the name atrioventricular or AV valves. The second set of valves are located between the ventricles and their corresponding blood vessels. The shape of these blood vessels are crescent shapes. The shape of these valves are crescent shapes, and therefore they refer to as semilunar or SL valves. So let's take a look at them at a little more detail. Now, the atrioventricular valves, there is again one on the right-hand side, one on the left-hand side. The one on the right-hand side has 3 little flaps or cusps that forms the whole structure, and therefore we refer to these as tricuspid valve. Hence, the word tri implies 3. Again, these valves are going to be located between the right atrium and your right ventricle. And the goal of these valves is that when your right ventricle is contracting, you don't want the blood to backflow into the right atrium. So if you kind of imagine your heart, and I'm going to show you this on a picture. If this is your right atrium and this is your right ventricle, blood moves from right atrium down to the ventricle. So when this ventricle is basically squeezing or contracting, blood has 2 pathways to take. One pathway is basically move up to where it came from, which is back to the right atrium, or blood can move from the ventricle up through the pulmonary trunk and away from the heart. Which one is the ideal condition? Going through the pulmonary trunk, and the one that you don't want to happen is going back to the right atrium. So when your right ventricle is contracting, the tricuspid valve is engaged or closed to prevent the backflow of blood into the right atrium. Similar concept applies to the one located on the left-hand side. The main difference is that the valve located between the left atrium and left ventricle only has 2 flaps and therefore is referred to as bicuspid. There is a secondary name for that. It's called mitral or mitral valve. Again, the goal of this valve is to sit between your left atrium and left ventricle. So when your left ventricle contracts, the blood doesn't backflow to your left atrium. So the only pathway it can take would be through your aorta. So here is your left atrium, your left ventricle. So when this chamber is squeezed or contracted, you want the blood to go through your aorta, which is this one, and not up back to your left atrium. Now, the second set of valves that we have described are called semilunar valves. Again, these are located between the left and right ventricles and their corresponding blood vessels. So right semilunar valve is on the right-hand side and associated with the pulmonary trunk. So what happens is, imagine your right ventricle contracting, and I'm going to show you this on a picture. So your right ventricle contracts, and it's going to push all the blood to your pulmonary trunk. Now, as soon as the right ventricle relaxes, what is blood wants to do? Blood wants to come back down with the gravity back to where it started from. Again, that is not an ideal condition. We don't want the blood to come back to where it actually started. So what do? We engage these semilunar valves right here, and basically prevent the blood from coming back to your right ventricle when it's relaxing. Because these valves are associated with your pulmonary blood vessels, we refer to them as pulmonary valve. On the left-hand side, we have another set of valves. You only see the back part of it. So this little kind of semilunar is the posterior aspect of these valves. And again, same function as is described. So when left ventricle is contracting, blood goes up through the aorta. When the left ventricle starts to relax, I don't want the blood from aorta to backtrack down to the left ventricle. So at that point, I'm going to engage these valves right here, which are your left semilunar valve. And that prevents the backflow of blood into your left ventricle when it is relaxing. Because this blood vessel is associated with your aorta, the secondary name for it is aortic valve. So for your exam, please make sure you feel comfortable with the name of the valve, their secondary name, their location, and their function. Now moving on to what actually caused our heart to beat. So I want you guys to kind of look back at what we described for muscular system before. So when we described a skeletal muscle system, basically the muscles that are under our control, we mentioned that the movement of these muscles and the contraction of these muscles are under the nervous system. Hence, if somebody has a stroke, part of their muscles or half of their body, including their facial muscles, are paralyzed. There is nothing wrong with the muscle itself, but because their communication with the nervous system has been affected, then they will not be able to effectively contract. Now, in terms of your heart, the best way for you to understand how your heart actually creates its electrical impulses, which leads to the heart contracting, is to think about patients that might be brain dead, but they're still identified as alive. So what does that imply? It implies that the brain is technically not functioning. However, the heart muscle still continues to beat. That indicates that your heart contraction is independent from your brain activity. So you can have a non-functional or limited functions associated with the nervous system. However, your heart still can create the appropriate electrical impulses that leads to heart contraction. So the question is, how does your heart do that? So your heart have these non-contractile cells. So there's a specialized kind of cells called non-contractile cells. And these non-contractile cells are strategically located in these bundles and structures throughout the heart. What is the job of these non-contractile cells? Their job is to create electrical signaling throughout the heart, which we identify as internal or intrinsic conduction system. And these electrical impulses eventually leads to your heart muscles contracting and therefore your heart beating. So I want you guys to again highlight, this is really important for you to understand. When we're thinking about your heart and electrical impulses, first point is that your heartbeat is independent of your nervous system, as an electrical impulse that leads to muscle contraction does not originate from nervous system. So where is it originating from? It originates from the heart itself with a specific or a specialized cells called non-contractile cells. These non-contractile cells are strategically located throughout your heart and create a path called internal or intrinsic conduction system. They create electricity throughout the heart, and that electricity causes muscle contraction, and muscle contraction creates the heartbeat. The second thing I want you guys to understand is that when we're thinking about electrical impulses and muscle contraction, your atria is going to always have the contraction force first, followed by ventricles. So kind of think about this. Atria needs to send blood down to the ventricles, and then ventricles are going to basically squeeze and pump that blood away from your heart. So atria job is to first contract and send as much blood down to the ventricle, and then your ventricles can contract and basically send blood either through your pulmonary circulation or through your systemic circulation. Here is a depiction of the electrical impulses or the internal or intrinsic conduction system of the heart. What you see in the picture are depictions of your non-contractile cells that are strategically located throughout your heart. So the first one that triggers this whole process, this whole electrical impulse in the heart, located on the top of the right atrium, and it's referred to as cyanoatrial or SA node. This SA node creates electrical impulses that is passed down to the next structure called the AV node. AV node is located at the base of your right atrium, basically between your right atrium and your right ventricle. Furthermore, you have these main branches that are forming right here called the branches of the AV bundle. And lastly, you will have these really tiny branches that come off and making sure that, again, the electrical impulse reaches every crevice of the heart. And these little tiny ones are called Purkinje fibers. So if I ask you guys to write the path of the internal or intrinsic conduction system of the heart, your answer should be SA node, AV node, branches of the AV bundle, and eventually Purkinje fibers. Now, some of the cool facts about your heart. You have about 5.5 liter or 1.5 gallon of blood in your system. And again, this number varies. We're talking about an average male typically when it comes to these numbers. In average, your heart beats about 70 milliliter or 0.1% of that gallon every time your heart beats. And if a typical heartbeat will last about 0.85 seconds. So a typical heartbeat takes less than 1 second. And that gives you an average heartbeat of about 72 beats per minute. So in average, you're pumping about 5 liters of the blood in 1 minute. Now, think about the intrinsic conduction system I was talking about earlier. SA node, which is the one that's located on the superior part of your right atrium, is the non-contractile cells that basically initiates this whole process, which leads to your heart beating. So SA node is known as the pacemaker of the heart. It is the one that regulates your heartbeat. Now, if your SA node is identified as non-functional for some reasons, and we're not going to get into that detail, then the next structure in line will take over. So the next structure, which is your non-contractile cells, is your AV node or your atrioventricular node. And that's basically going to be doing the job of your SA node, creating the intrinsic conduction system of the heart or initiating the intrinsic system of the heart. Is AV node as strong as SA node? And the answer is no. However, you can have a functional heart and a relatively healthy life with AV node being in charge. However, in many cases, the patient is recommended for them to place a pacemaker to basically control the activity of your SA node. And by placing a pacemaker, you're basically allowing the pacemaker to take over the function of the SA node and set the rhythm of your heart. Now, I want to add a concept in terms of the role of your nervous system in terms of your heartbeat. So we established earlier that your brain is not involved in terms of creation of your heartbeat. So you can have a person that's basically have almost a non-functional brain, but their heart still beats. So what is the role of your nervous system? Nervous system role is to tell your heart how many times to beat. It's not going to tell it how to beat, but rather how many times to beat. For instance, let's say you are exercising. Typically, when you exercise, your heart rate is going to go up. So when your nervous system notices the need and requirement for a higher level of either blood pressure, a higher level of oxygen movement, removal of CO2, whatever reason that triggers it, your brain sends a signal to your heart telling your heart that it needs to work faster. But it's not going to tell it how to do that job. It's just tell it to work faster. Also, it can give you scenarios like when you're sleeping, where your brain notices that you don't really need a high circulation. So it sends a signal to your brain, it sends a signal to your heart, telling your heart that I'm not telling you how to do your job, but I'm telling you that you need to work slower. So make a distinction between how to do the heartbeat versus how many times to do the heartbeat. Now, if you work in a hospital setting or you have ever been around a patient or person that might have a problem with their heart, one of the first procedures they do is to take an electrocardiogram or ECG, sometimes referred to as EKG. ECG is basically an electrical reading of the electrical charges inside the heart, or sorry, I should say recording of the electrical charges that is taking place in a heart during one cardiac cycle, which basically means one heartbeat. Now, typically when you look at a healthy, normal sinus rhythm heartbeat, you will see three separate structures. These structures are the first one you see right here, called the P wave, which is relatively small. A really pronounced peak, which is called the QRS peak. And then a smaller structure called a T wave. Now, based on what we understand, we already know that your atria is going to contract first, followed by ventricles. We also know that your ventricles are larger than your atria, and therefore the electrical impulses created by your ventricles are going to be larger than your atria. So what do we have here when you think about those concepts? The first one we have, which is your P wave, is when your atria is about to contract. Atria is about to contract. After atria contracts, you follow that by this really large peak, which is what? Your QRS, and logically will be associated with your ventricles are about to contract. So atria about to contract for P wave, and your ventricles about to contract. T wave, which is the last wave we have, is when your ventricles are start to recover or relax after their contraction. So based on what you see on a typical ECG, the question rises, why only three structure within the ECG? What is missing from this picture? So if you look at this, you have contraction of the atria, contraction of the ventricle, and relaxation of the ventricle. So what is missing from this picture is relaxation of your atria. Now, That doesn't mean that your atria is not relaxing. It doesn't mean that there is no electrical impulses or charges associated with your atrial relaxing. However, here is what's happening. The atrial relaxation happens at the same time your heart is doing what? Getting your ventricles ready to contract, which is the QRS complex. So because the QRS complex is such a large complex, it basically overshadows the atrial relaxation. So if my question asks you, your heart does not have an atrial relaxation, that's a false statement. But if I ask you, you do see an atrial relaxation wave on your ECG, that's a false statement, because the atrial relaxation wave has been overshadowed by your ventricular or your ventricles about to contract. So do keep that in mind. Now, there are scenarios where you will not see your normal ECG, or what we identify again as sinus rhythm. So these are the scenarios which we identify typically as ventricular fibrillation. So the problem is usually associated with your ventricles. So as you can see in this picture right here, there is really no specific patterns or waves that are visualized associated with ECG. Again, this is typically identified as ventricular fibrillation. It is basically a disorganized electrical impulses or activities within your ventricles. It is really dangerous if somebody is dealing with this, because basically the lack of coordination within the ventricle prevent the blood to be effectively circulating through either your pulmonary or your systemic circulation, which can lead to death, as the tissues will not receive their oxygen. What can cause a fibrillation? The most common one would be heart attack, some sort of heart injury, or drug overdose. One of the most effective ways of treating a ventricular fibrillation, which is almost immediate, is by placing two pedals, one pedal on the top, one pedal on the bottom of the heart, and passing an electrical impulse through the heart. So the goal is that when you are going to shock the heart, you are hoping that the heart kind of jolt itself back to its normal rhythm. Now, the machine that we use to do so is called a defibrillator. It's basically, you have seen it in probably many of the movies. It's relatively easy to use, two pedals, and then you basically send typically a small electrical shock, and then if it doesn't work immediately, you increase the amount of electrical impulses through the heart slowly. Please also do note that if somebody has a normal heart rhythm and gets shocked by a defibrillator, that can actually lead to an irregular pattern of the heart. So shocking a heart with a defibrillator that was working properly can cause problems in the heart. Now, the next thing that we're going to talk about is your blood pressure. So blood pressure is basically measured when you have your heart is both beating as well as the heart relaxing. So it happens when we identify the word systolic and diastolic. You may have seen the shorthand for these two words on either on the side of a blood pressure machine. The word systolic is associated with the word systole, which means contraction of the heart. So systole. And diastolic comes from the word diastole, which means relaxation. So basically, systole means it's the pressure when your heart is basically contracting. The number is going to be a higher number. It measured in millimeter of mercury, or mmHg, and it's measured at 120. And diastolic pressure is when your heart is relaxing, therefore causing the pressure to drop. That number is typically about 80 millimeter of mercury. So this is a lower number, and again causes when the heart is relaxing. A blood pressure machine is called a sphygmomanometer. This is typically depicted as the one that is measuring your blood pressure on the brachial region or your arm region. However, there are other version of it that uses the wrist as a way of measuring, although that measurement is typically not as accurate as using the brachial blood pressure machine. You can watch the video link that is available here to get more access about the information about blood pressure. Okay, guys, so let's go ahead and continue. So the next concept I wanted to kind of go over with you guys is the changes in blood pressure, as well as a change in the velocity or a speed of blood as it goes through the different categories of blood vessels. So in this picture and the graph, we start with arteries. We have arterioles, capillaries, venules, and veins. If these words sound familiar to you, please go back to the part 1 of cardiovascular system to review the terminology. We also have 2 major lines that I want you guys to look at. Is the one that is associated with blood pressure, and again velocity, which is the speed of fluid flowing inside your blood vessels. So the velocity of the blood is pretty high and consistent during the arteries. And in arterioles, it starts to drop, but even though it's dropping, it's not as significant until it reaches your capillaries. And you can see this significant dip as it reaches the capillaries. Now, after it passes the capillaries and empties into the venules and veins, you notice that the speed is picked up again. So the question is, why do I have the lowest velocity when I'm passing through the capillaries? And the reason for that is that this is the location where you have your gas exchange taking place. So this is the location you're either picking up oxygen or dropping off carbon dioxide if you're talking about tissue, or if you're talking about your lungs, you are picking up oxygen and dropping off CO2 in your lung tissue. So regardless of the type of gas exchange, you really need a little bit of time to allow that exchange to take place. So that's why you have the lowest level or lowest velocity when it talks about capillaries. Now, if you look at your pressure, you have a relatively, again, stable pressure in arteries, and then you see this kind of a significant drop in your arterioles. And then for the rest of this, which is your capillary, venules, and veins, you have a relatively stable pressure. So the main reason for this most significant drop being observed in arterioles is that they provide the highest resistance against the blood pressure, which basically forces the blood pressure to significantly drop. So make sure you guys can distinguish between severe drop in blood pressure versus severe drop in velocity. This is what we already talked about in detail. I did a drawing for you on part 1. However, we're going to continue just kind of looking at this. You have the right side of your heart, you have the left side, and it is separated by the septum. Here is your right atrium, receiving blood from the inferior and superior vena cava. Blood goes down to the right ventricle, and then from there it goes through the pulmonary arteries to your lungs. Notice that there is a gas exchange happening here, where oxygen is getting introduced into your blood vessels and CO2 is leaving. So you have the transition of blood going from deoxygenated to oxygenated. Blood then returns through the pulmonary veins to your left atrium, goes down to your left ventricle, and then through the aorta, it gets sent to all of the tissues and bodies in your body, in basically every place in your body. There is another gas exchange happening here where your tissues are going to pick up the oxygen and they're basically going to dump off the CO2. And during this transition, you're going from oxygenated blood to deoxygenated blood. And this blood again returns back to the right atrium and the whole process repeats itself. We have talked about this, that the circulation that goes to the lungs for the purpose of oxygenation is the pulmonary circulation or circuit. And the one that goes to all of the cells, organs, tissues, etc., for the purpose of gas exchange and providing oxygen for the tissues is referred to as the systemic circulation. Here is a simple way of thinking about the path of blood through the heart, through the valves of the heart, as well as through the blood vessels going to the body. This is a really important step for you guys. Make sure you guys can walk through this on your own for your exam. Here's another depiction of what we just talked about, same information. Nothing really different, just a different representation of the information. So moving on to what we identify as coronary arteries. Coronary arteries are the blood vessels that are going to supply the heart itself. So remember, your heart is a muscle that is basically at minimum beating about 70 beats per minute from basically the fetal stage all the way to the moment of your death. So this is a muscle that is continuously under pressure. It never stops, which is a good thing. And therefore, it requires a lot of oxygen and therefore, it requires a lot of energy and therefore requires a lot of oxygen. So the oxygen the heart itself uses to act as a pump is supplied by blood vessels called coronary arteries. Now, there are two main branches of the coronary arteries that are coming off your aorta. So here in the red, down up here, that's your aorta. And you can see two main blood vessels coming off of your aorta. You have left coronary artery and you have the right coronary artery. And then these arteries are basically going to form branches on the surface of the heart and making sure your heart is effectively supplied with oxygen. Please do note that these blood vessels are relatively small, which means that these blood vessels can be clogged if there is unhealthy habits in the person's life, lack of exercise, some sort of thickness of the blood that makes it more susceptible to stick to your blood vessels. So any of those conditions make you more susceptible to coronary artery disease, which basically again means that your blood vessels are going to be more susceptible to blockage and clogging and limiting the supply of blood to parts of your heart. Now, if these blood vessels are clogged, then you have what we identify as myocardial infarction or a heart attack. Now, we'll talk about heart attack in a little bit more detail, but before we do that, I want to kind of hint at some of the other conditions that may lead to heart attack. One of the main conditions that can lead to heart attack and is identified as silent killer is hypertension or high blood pressure. Again, hyper means basically above and tension means pressure, right? So hypertension basically means high pressure. So what we identify as hypertension is when your systolic, which is normally about 120, is above 140. And what we identify as your diastolic pressure and about 80 millimeter of mercury to be above 90 millimeter of mercury. So I have people asking me, well, I exercise and I measure my blood pressure and it's 150 over 95. Does that mean I have hypertension? And the answer is no. You are expected to have fluctuation in your blood pressure regardless. The difference comes from do you have that high blood pressure continuously when you're even relaxed, or is it during the time of exercise or significant pressure? If it is a continuous condition, even in a relaxed stage, then that means that there is definitely an issue. Now, people who have what we identify as atrial sclerosis usually do have hypertension. I will talk about atrial sclerosis in the next slide, so bear with me. What are the typical treatment for somebody who has high blood pressure? They can typically take medication that is identified as diuretics, which basically means medication that is going to remove water from your circulation and put it back into your, get it out of your system. And that causes the blood volume to decrease and therefore your blood pressure to decrease. You also have medications called typically beta blockers that deactivates hormones that may increase your blood pressure. So they're suppressing your blood pressure from basically spiking. Now, does that mean if somebody has these or is on these medications, their issue is resolved? Unfortunately not. If you have continuous hypertension, you're still at a higher risk of cardiovascular disease, even if you are taking your medication. So we mentioned that people who have atrial sclerosis may be more susceptible to hypertension and cardiovascular disease in general. So what is atrial sclerosis? It is when you have either lesions or plaques forming inside your blood vessels. So look at this is a normal diameter of the blood vessels. If you kind of see it, this is the normal blood vessel. And you notice that half of it is basically clogged. So the diameter of the blood vessels is half of its normal. Again, this is really dangerous. It makes you more susceptible to hypertension. This could be a result of either very thick blood, where your red blood cells clump together and block part of your blood vessel. This is common in smokers. You also may have people who have sedentary lifestyles. They eat a lot of trans fat, unhealthy food in general, high in fat. In that case, you basically build plaques or fatty tissue within the wall of your arteries and narrow those down. There's a couple videos I would strongly recommend for you guys to see it, as there will be questions directly from those in your exam. So if somebody has atrial sclerosis or they have hypertension, again, they will be more susceptible to a heart attack. So what is a heart attack again? It is when you have your blood vessels that are supplying your heart itself, or what we identify as coronary arteries, are partially blocked or fully blocked. So what does that mean? When these blood vessels that are supplying the heart are blocked, that means part of your heart will not receive oxygen, and therefore that part of the heart will die as a result of lack of oxygen. Now, heart is the organ that literally supplies the rest of your body with oxygen. So if that is damaged, basically you are going to deprive the rest of your body of oxygen as well. Now, there are people who recover from one or multiple heart attacks, and there are people that may die as a result of a single heart attack. What's the difference? The difference might be the blood vessel that is actually blocked or clogged. So if the blood vessel is the main one that typically supplies your left ventricle is the one that is pumping blood to basically every part of your body. If there is a massive blockage in one of those blood vessels where part of your heart, literally, more specifically, your left ventricle dies, then you're literally shutting down your systemic circulation. There's really not much coming back from that. So these individuals have a lower chance of survival compared to somebody who may have a blockage on their blood vessels on the right atrium or the left atrium, or even right ventricle. So the most dangerous type of heart attack is the one that is affecting the blood vessels that are supplying your left ventricle. Can aspirin keep your heart attack away? A lot of people do take aspirin. Aspirin is important in terms of making your blood thin, which makes it basically easier to pass through narrowed arteries. And therefore that can help you have a higher chance of supplying your heart even if you have a blocked coronary arteries. Does that protect you from a heart attack? Not necessarily. What are the possible treatments for a heart attack? Or if somebody is at risk of heart attack, what can they do for them? They can do two procedures. One is called angioplasty. This is basically you pass a plastic tubing with a catheter through the narrowed blood vessel, and then you pump the balloon that is attached to that, and you open it up, and basically you push the fat or the blockage to the side of the blood vessels. So you literally kind of think about you have a clogged pipe and you push everything to the side to open up the passageway. In some cases, they may even add what we identify as a stent. Basically, it's kind of a scaffolding that makes sure that the blood vessel doesn't collapse on itself. In cases where the blood vessels are completely blocked, then they may complete a procedure called a bypass surgery or a CABG. So imagine in this picture you have, there is a blockage right here. So this is a blockage site. So what they have done is they've taken a blood vessel from typically your leg, because there is multiple blood vessels in the leg. So you can remove one basically without damaging the leg circulation. And you take that blood vessel, and on one side you connect it to your aorta, and on the other side you literally bypass the side of the blockage and you connect the other end right below it. So basically your blood supply comes to here and it stops. So what's your solution? I'm going to create a new path and then continue after the blockage. There are two links down on the bottom. These are really important to help you understand how to carry out the process of bypass surgery or CABG or quadruple bypass, as well as the angioplasty. Please do take a look at them. They do provide more details for you as far as how these procedures are done. Last topic I want to talk to you guys about is just kind of giving you some numbers and some ideas of what other reasons can lead to cardiovascular disease. Now, in average, the cost of healthcare and loss of productivity in individuals with cardiovascular disease adds up to about $444 billion, which is huge. Unfortunately, African Americans are at the higher risk for cardiovascular disease. Some components has to do with genetics. People who consume alcohol as well as smoke are at a higher risk. Alcohol can cause irregular heartbeat, and nicotine can cause constriction of the blood vessels as well as lowering your oxygen level because it replaces it with carbon monoxide. Obesity also puts you at a higher risk of cardiovascular disease because it is forcing your body to create new blood flows to the extra tissue that you have basically, and that causes your heart to work harder. And lastly, poor diet, which is something we have discussed multiple times so far. Diets that are high in either saturated fat or trans fat, which leads to an increase in your bad cholesterol or your LDL and a decrease in your good cholesterol, which is your HDL. Again, take a look at the video that I provided for you guys. It will give you some additional information that can help you with your understanding of the concept. Something else that I wanted to talk to you, even though it's not associated directly with cardiovascular disease, it also relates to the nervous system, is a stroke. A stroke is blockage of the blood vessels that are found inside the brain. So kind of similar to heart attack, but this happens in the brain instead. So part of the brain dies because of lack of supply of oxygen, and that can lead to paralysis of your muscles or death in cases if the brain damage is severe. Aneurysm is another case. It is when a person has either atrial sclerosis or hypertension that causes the wall of the arteries, basically the structure of the artery, to become unstable. That causes ballooning of parts of the blood vessels. This ballooning can happen in abdomen, in your brain, in your lungs. And if that actually ruptures, it can cause internal bleeding, and that basically can cause death. Best way to treat an aneurysm is by replacing the damaged vessel with a plastic tubing. However, there are people that may die as a result of an aneurysm because it didn't get caught. It wasn't caught on time for it to be repairable. Okay, so that's about it. Please go ahead and review your study guide, make sure everything is clear, and let me know if you have any questions.